just recording our conversation.
We're on.
So first we're going to start off by adding Kevin's last name and then first name. If you can just spell your last name.
L-E-U-N-G.
L-E-U-N-G. And just K-E-V-I-N. Yeah, just to... This is a built-in lead barrier, and I brought an extra today, a portable lead barrier, because we had talked about there's only really room for 3 people. So I'll be sliding this back to be able to instruct Kevin how to move, and then when I go back to film, we'll sort of angle it. And the x-ray doesn't turn corners. The x-ray will go right into the image intensifier, so like a catcher's mitt. So you don't have to worry about anything over there. So Kevin, what first we're going to do, we have to show who the patient is and who's starring in the movie. So I'm going to have you stand up. And Dr. Foley, did I spell your name right?
Yes.
Okay, thank you. So I'm going to have you stand up and maybe hold it right behind here, because we have to take your picture for identification. So you can stay right there. I'm going to turn my camera towards you, and I'm just going to have you look straight ahead. And lower this down just a little bit. And we're going to take your picture for 10 seconds so we know who you are.
Is that would imply kind of supervising?
Right, Dr. Postaway?
Yes?
Dr. Foley has requested before you take that picture that his name not appear on there. I understand you're using it for demonstrative purposes, but that would infer that Dr. Foley has made some sort of referral for a diagnostic. And Dr. Foley has asked that perhaps we just change it, leave it blank, or change it to a phone name like Smith.
Just
If
leave
you
it
don't mind.
blank.
Want to leave it blank?
I think so.
Yeah, that's fine with me.
We know it's part of the case.
Sure.
Not to worry. There you go.
No problem.
Thank you very much.
So I'm going to come back right about that. And you just look straight at that camera. So what we're going to do is take your picture for 10 seconds. So you can look straight at that camera. So stay right there. And as soon as the 10 seconds are up, Kevin, I'll let you know. So just stay right there for a few more seconds. Perfect. It's a take. We have your photo on film. So I'm going to take this back over here. And what I'm going to do, Kevin, is talk you through basically 7 different movements of your neck, one by one. So I'll explain one movement, and then I'll have you practice it, and then we'll film it. So let me just raise this up. So I'm going to show you first on myself, Kevin, if you could just watch me. The first move I'm going to have you do is to keep your neck straight. So don't bend your neck. Take your chin from level, and I'm going to have you lift your chin up and out, and then back to level. Up and out all the way, and back to level. It's almost mimicking the movement. If I asked you a question, you go, uh-huh, but I want to see your skull rock. So maybe you want to try, so chin up and out, and then back to level. So not bending your neck, just that. Yes. So I'm going to have your left shoulder touch the camera. I'm going to have you look straight ahead towards the wall, and have your left hand right over there.
Okay.
So your left, yep, and your left shoulder touching. So you're actually touching that camera. And I'm going to raise this up just a little bit. And don't take a step, I'm just going to push you a little bit forward. And I think you're in the center of the camera, but I won't know, Kevin, until I look in my monitor.
Okay.
From this point, if I need to have you move, please do not take a step. But I may have you lean a little bit, tiny little bit forward, or a little bit back. And once you're right in the center, then we're going to say chin up and out, back to level. We'll do that like 3 times. So let me come around over here. I don't know if you want to... If you want to see over here, or whoever. Okay, chin up and out, and back to level. Good, chin up and out, and back to level. Chin up and out, and back to level. Excellent job, Kevin. Stay right there. Perfect. If you want to sit right there. Perfect, stay right there. Next, Kevin. The next, you can stay right where you're at in the perfect position. Now I'm going to have you bend your neck. So I'm going to have you bend your neck, so you're going to be looking all the way down towards the floor,
Okay.
and then all the way up towards the ceiling. We're going to do this.
Like the floor?
Yeah, going as far as you can. We're gonna do this 3 times. The first time will sort of relax you, the second time hopefully go a little bit further, and then the third time we'll get the most motion. And I'm gonna start off looking straight ahead level,
All right.
and I'm gonna lower this down just a tiny bit. I'm gonna twist your shoulders a little bit more parallel to the wall. Try to relax. And I think you're in the center, but remember, if I need to have you move, don't take a step. I'll just have you lean a little forward or back.
Okay.
But we're gonna do this 3 times, bending your neck. So stay right there. So I'm gonna come over here. I'm gonna push record. Good. And head down all the way as far as you can. Good job. And all the way up towards the ceiling, Kevin, as high up as you can go. Good job. Head down all the way as far as you can go. Good. And all the way back up as high up as you can go. And one more time, all the way down. You're doing a great job all the way. And all the way back up as high up as you can go. Good. And look straight ahead level. Good job.
Sorry.
Perfect. So next, stay right where you're at, Kevin. I'm going to have you pivot.
ringing the bell there.
Pivot to the right at a 45-degree angle, so you can turn your feet to the right and your shoulder, and you move that hand just a little bit. And then can I have you take a side step, a little tiny side step to your left, just a little step, and your shoulder touching there. Perfect. Keeping your shoulders here, can I get you to turn your head so you're looking straight this way? And I'm going to have you bring your head all the way down and all the way up at this funny angle. At this angle, we'll be looking where the nerve roots come out the side of your neck. So let me take a look. I'm gonna pull you back just a little bit. And I think, yeah, and let's see if you're in the center. And stay right there. I'm gonna lower this down just a little bit. Watch your shoulder. Good. Perfect, Kevin. Over here. So we'll go over here. Good job, Kevin. Head all the way down towards the floor. Good. And all the way back up towards the ceiling. Good. And head down towards the floor, straight down towards the floor as far as you can. And straight up towards the ceiling, if you can. And look straight ahead level, Kevin. Can you lean backwards a little bit? Move your body back, your shoulders backwards. Oh, don't take a step. Okay, good. Now head down one more time. All the way down and all the way back up. And back looking straight ahead. Good job. Great job. So now, Kevin, we're going to turn you to the right towards me. So you'll have to let go of that hand. So your feet are going to be facing mine. So our shoulders are together. Doing good. Right shoulder there. This hand can go here. And I'm going to have you look this way, pretty much over towards that little outlet, towards the camera. You'll be bringing your head straight down, straight back up. We'll do this 3 times. And if I need to move, just but if you look straight there, let me push you forward. And I think it's right there. Okay. So when we come back over here, it's the opposite side we're looking at. Good. Head down towards the floor, Kevin. Excellent. And all the way up towards the ceiling. All the way. Good. And head down towards the floor as far as you can. Good. And all the way up towards the ceiling. Good. And look level. Lean a little bit forward, just a little bit. Good. Now head down one more time. All the way. And all the way back up as high as you can go. And back to looking straight level. Straight level. Good. Perfect. All right, Kevin. I'm going to have you turn so you're facing forward. This next view, what I'm going to have you do, but not yet, is lift your chin or your jaw upward. I want to look at your neck without moving your shoulders. I want you to lean your right ear to your right shoulder, left ear to your left shoulder. So I'm going to lean from side to side. Try not to recruit your shoulders, but you got to lift that chin up. And let's just have your left hand over there just to stabilize yourself. Good. So let's take a look. See how you're looking straight on. Here we go, Kevin. Chin up. Right ear to right shoulder all the way as far as you can. Good. Left ear to left shoulder as far as you can. Good. Right ear to right shoulder. And left ear to left shoulder. And one more time to the right. All the way. And all the way to the left. And back straight up. Good job. Perfect. Two more. So next, Kevin, we're going to have you stabilize your shoulders just like you did. Only this time, I'm going to want you to turn your head to the right first, as if you're driving your car and you're trying to back up and you're looking over your right shoulder, and then you're looking to the left. And we're going to do that 3 times. I'm going to raise this up just a little bit. No, we'll get a little bit more on the side. Right there. So you're going to start off looking straight, and we're going to go to the right first. So here we go. To the right all the way, Kevin. Good. And to the left all the way. Back to the right all the way. Back to the left all the way. And back to the right one more time. And back to the left one more time. And back straight ahead. Excellent. Okay. The last one is called the open mouth. I don't know if I've ever told you, but behind your teeth, hide the 2 most important bones in your spine, the first and second bone. It's what your head sits on. So by opening your mouth, it gets the teeth out of the way. You don't have to do it yet, but when you open up your mouth and you tilt your head to the right with your mouth open and to the left, it allows us to look at the first and second bone as you're leaning from side to side. The most important thing is our camera's looking straight into your mouth. That's why you get your teeth out of the way. So as you're leaning, if you end up turning your head a little bit to the right, my camera won't be able to see clearly, so I may give you an instruction saying, hey Kevin, turn your head to the left a little bit or to the right. So I really want you to focus on that circle, that's the camera lens. So, and also, when you first open, if your teeth are in the way a little bit, I may say tilt up or down to get your teeth out. So first we're going to get the right angle, and then we're going to have you lean from side to side. So with your left hand over there, we're almost done. I'm going to have you take a tiny little step forward. Just a little bit more. Good. And chin down just a tiny bit. I'm going to raise it up. I'm going to keep you in the center. And again, so first we're going to get the right angle, and then we'll have you lean. So really try to relax. Here we go. Over here. Get ready, Kevin. And open. Perfect. Right there. Right ear to right shoulder. All the way, good. Left ear to left shoulder, good. Right ear to right shoulder, all the way. And back straight up. Try to keep your nose straight and go back to the left. Again, all the way to left and chin down a little bit. Good. Back to the right one more time, Kevin. And chin down a little bit, chin down, good. And back to the left, all the way to the left. Good. And back straight up. And close your mouth. And open, and close, and open, and close. Perfect. Got it. It's a take, Kevin. We have your motion x-ray. You can take a seat right there. Let me come on around over here. Perfect. Kevin, if you have a minute, I'd be happy to show you what we just did so you can see, give you a preview. What we did is we photoed you for 10 seconds. So that way we know who this neck belongs to. We have your name, the date. We shrink you down in the corner into a picture-in-picture. And while you're moving outside, we're looking inside you live. So it's live x-ray, and we're looking at the back of your skull to see how it moves between the first bone and the skull as you're lifting your chin up and down. Next, we're going to have you bring your chin to your chest, and we're going to have you look up towards the ceiling. And this is what I was looking at as I was doing this procedure so that I could instruct you. I can have you lean forward, lean back, I can control the energy, and this way we can get the image we need to. You did a great job. You pushed it as far as you could, and that's important. We want you to move as far as possible. So each of these different movements, we're evaluating different ligaments. So as you turned, we kept turning you 360 degrees, we turned you there. We now are looking at the right side of your neck where the nerves come out. And the nerves come out through these holes, these light-colored holes. And all these holes should be nice and big as you bend down and as you bend up. And if they get a little bit smaller, that possibly could indicate that you could be pinching nerves on that side of your neck. And we're looking to see how the joints move. So that was the right side of your neck you were doing that. You may have felt some things, you may not have, but we'll just give you a sneak preview here. We're going to look at the left side of your neck. Same thing, we're looking at the holes, the light-colored holes, and where the nerve roots actually exit the left side of your neck. And we put you through all those motions. So what do you think? Have you ever seen anything like this before?
Okay, if you could also just get a scan of this as well.
So that was the left side, and then we turn you a little bit more. We're going to go straight on into your neck. We'll turn you again,
Okay.
and here we're looking to see if your neck's nice and straight. And we're seeing, does your neck bend to the right and to the left? And you can almost see, it sure looks like you're bending a lot further outside your body, but when we're looking inside, you can see your shoulders are recruiting a little bit there. You probably felt that, but you did a great. Yeah, you did a great job there. I mean, it's just. And then the second to last is the rotation. We're trying to see, can you turn your head? Can you look over your shoulder to the right? Can you look over your shoulder to the left? And you can see all your teeth. You can see the roots in your teeth. And then the last one's that open mouth that we're evaluating the top bone and the second bone, and that's what your head or the skull sits on. You'll open your mouth there, and I can freeze this at any point. We're looking at the second bone in your neck is this pyramid-shaped bone. There is a triangular bone here and a triangular bone here. This triangle and that triangle are hooked together by a ring of bone. We can't really see the ring because it's very small, but we're trying to watch the two triangles. Do they stay lined up here and here when you lean from side to side? So as you go leaning from one side to the other, we're trying to see, does this point, does it slide off here? And we're looking at the spacing between these two bones and that little spacing there. So we're comparing right side of your neck to the left side of your neck. And again, we're having you lean from side to side. You did that perfect. And then the last view, after you did this, we had you open and close your mouth, which we're doing a little screening for your jaw to see how it opens and closes. So we'll have you close your mouth here, see how the teeth fit together, open and close. And that's the complete procedure. You did a fantastic job. Thank you for volunteering your cervical spine for this demonstration.
Okay, thank you. You can stop the tape.